Hello and welcome to this very special show on World AIDS Day. December 1st, every year we celebrate World AIDS Day. We have with us today someone really special who's been working for the transgenders for years now. She's a transgender activist, Shreegauri Sawant. She's also a trustee with Sai Savli Foundation Trust. Shreegauri ji, thank you so much for joining us today. You've been working for years now for the community. Tell us about the canteen, which you specifically started to ensure that the transgenders in the vicinity, mainly HIV and AIDS infected, get one nutritious meal a day. What really was the thought behind this?
Thought was not, the room was not built in one night. It is like that. When I leave my house, my biological family, I found so many difficulty. When I was on street, I was on begging. I used to, sometimes the hotel people not used to allow us to eat the food. And if you see the transgender, most of the 80%, those who are in the sex worker, they might be don't cook. So they order from the hotel, any Delhi Darbar or any hotel and veg biryani or something like that. So that was not nutrition food for them. And hunger, the money is for hunger. First priority, you have to fill your stomach. So then I thought, why not we have to take an initial? But it was not that easy for, my guru is Tamilian. So we say, sapadingala, khana khaya kya? So the khana khaya is to, and they used to say, ha, bhaji pav kha liya. Hey, dil hai mushkil jeena yahan, Bombay, the vada pav. The transgender used to say, ha, maine vada pav kha liya. So then I started, why only vada pav? If I know my sisters are suffering from HIV AIDS, so they need a nutrition food. So Sakhi Chachoki took an initial, at least one time they should have to get a proper meal. So what was the proper meal? We gave only vegetarian foods. So vegetables, sometimes vegetable rice and love. So it was basically the community kitchen by the community people. It is only for us. So the touch was that at least Guru will cook and give for me.
Okay. So, Maharashtra has one of the highest instances of HIV infections in India. What are some of the socio-economic reasons behind this epidemic in the state? I mean, tell us about that because you've been working here for so long.
So that is very bad, so long I have to work on this. I don't feel that is proud, The work should be for 2 years, 3 years, then you should have to move out. Several years. I started my journey from 1999. Still, I'm working on HIV. And the prevalence, if you see, in 1999, the prevalence was 6-7. But now the prevalence is 8%, 9%, which is high. So I should have to feel shame that when I started working, it should have to get decreased. But nowadays, it is going high. So we have to see the causes why it is going high. If you see the minorities, the prevalence of HIV is, I work with female sex workers, transgenders, migrants. The prevalence is very high. Only dumping a condom is not only the solution on HIV/AIDS. We should have to understand the myths of the condom, we have the, how to use and everything. Yes. Basically, when people talk on HIV, they won't say HIV, they first say AIDS. We should have to understand what is the meaning of HIV and AIDS. Yeah. Immunodeficiency virus means अपनी रोग प्रतिकारक शक्ति कम होना और धीरे-धीरे नष्ट होने के बाद AIDS हो जाता है. The stigma is such a high. And what are we giving? The government World Bank is giving several money on this. But what is the use? If I am getting a nirod, if transgenders and homosexual means I say MSM, we have the word MSM, man who have sex with man.
Yes.
Behavior bisexual. So we use the word MSM. So if we are practicing anal sex, so I need a more lubricated condom more than nirod. I need a jelly. If you are giving me only nirod, it is going to tear. So prevalence, it will be remaining like that. So we should have to understand what we actually want. And the risk behavior is, yes, it's more risk.
I mean, in fact, like what you said about discrimination and what really is, it's important to understand the need of the community. But despite the Supreme Court's recognizing India's 2 million transgender people as a third gender with equal rights in 2014, many still face a double discrimination, not only the risk of being shunned and abused, because of the gender identity, but also because of HIV status. So what are really the challenges being faced by the community? Discrimination, stigma is, of course, a huge challenge.
Very fun, a lovely question. No one asked me this question. So thanks for your brain. Yes. See, discrimination within community we don't have because we all are sex workers. So we know, we always say कोयले के खान में काम करते तो कालक तो लगेगी. Queen's community knows that we are the sex worker, so one day I will get infected. So they know the stigma, the vulnerability is from other world. And I always say, when you call they are the sex workers, I stay on the one street only. But who comes to me? बाहर के लोग ही हमारे पास आते हैं. They are the mediator, they are the butterflies who spread the love. So if you see in our community, it is very okay nowadays. You know, we are very okay. Like how you say, अरे मेरे को डायबिटीज है, मुझे चाय में शक्कर कम डालना. And you get respect. सामने वाला बोलते हैं हाँ ठीक है आप काम करो. So nowadays we also accepted as oh I am HIV positive, तो मैं ये नहीं करूँगी. But stigma from outside, how the people, because people have myths. We have very less advocacy on what is HIV/AIDS. एक दो हिंदी फिल्म आए थे, फिल्म मिलेंगे and all, but people still don't know. I work with female sex workers. 10 years, 12 years. You know, 2 महीने का छोटा छोटा बच्चा, those who are HIV positive, mother can't feed them also. So, you know, vulnerable, how you look at this stigma, it is from two ways.
Yeah.
We are okay with that because we know एक दिन तो मरना ही है. It is like this. But I say it is shame for me. If you see the prevalence.
I mean, what you said, it makes me also think a lot. I mean, yes, it's, you know, the stigma, and many times, I mean, you know, people with HIV, Shreegauri ji, many times people don't come out. They don't go and take the medication because, again, they are scared of, you know, being called an HIV or an AIDS, living with HIV. So you, like said, you've been working with the sex workers for years now. It's been a challenge. It's been a long journey. Specifically in Kamatipura for many years, right? This community remains the most vulnerable to the AIDS epidemic despite targeted awareness programs of the government. What are some of the ground realities and measures needed to tackle the spread of the disease among this section of the society? Since you've told us the challenge, the stigma, tell us what measures could be taken.
See, what is the meaning of society? Only my transgender sisters and sex worker female. Are you with us? If we say society, and how I say the clients, the partner come from your world to my world. They are the mediators. So आप, मैं और हम सब मिलके society है. This is first thing. What we have to do, I'm not blaming anyone. What now we have to do? Government have to look at the sex workers, you know, their needs, the midday meal, you know, good qualities of condoms, antiviral therapies, you know, ART tablets. I should have to get my people every month proper tablets, proper nutrition foods, you know, good everything, which is no, we are not getting. Nowadays, if you see, because of this pandemic, previously, first time, it was shortage of medicine. Now, the SACs have already working start. The National AIDS Organization, NACO, what they have said, no, each and every person have to get his medicine. So now we are giving door to door them. At least they should have to see what HIV means. What every day you have to take 2 tablets only. It will keep you healthy, happy. You have to take care of your CD4. It don't have to get decreased. So we are doing this. But government have to look at the only sex workers. See, when we are say marginalized community, the needs and requirements are, we need a good place, good support system. Medical treatment should be also, the paramedical staff, doctors should have to be trained and sensitized with HIV positive. Yes.
I think the word you use, sensitivity, compassion, you know, all this is really the need of the hour, of course, besides the medication. Tell me, do you feel that the key population groups, you know, that are particularly vulnerable to HIV and frequently they lack adequate, access to services like you just said? And obviously the COVID-19 pandemic has further pushed the transgender community. Yes. What are your thoughts on that?
See, when pandemic came, first day even I clapped, first day even Thali Bajao, I did it. I was not sure that what will happen. After 3 months, I realized I'm losing my everyone. It also disturbed my community also. We don't have the train pass and all, so we could not be able to travel from one place to another. Yeah. Going for medicine center also, it was very difficult for me to travel from local train. If sex worker was shut down, my main business, if you see my community people, we do only sex work. The sex work was shut down. Yeah. No clients was there. So automatically my financial stable was going down. If I won't get a good food to eat, sufficient money, I'm going to take a medicine. Do you think so?
The basics, you need the
Basic
basics
thing.
first.
So then we ask for the government, at least the transgender. But in Maharashtra, very less people did not get, means people, means 30% only people get money. Why? See, I always say ki make us legal identity. In India, sex workers is not legal identity.
Yeah, absolutely. I mean,
so make it legal. So might be my queen, my sisters will get money. I'm a transgender, I can go and clap somewhere else. But my female sex workers, जो एक छोटे से घर में रहती है, the घरवाली take care of them. If they have a kids, I know शाम को वो अपने बच्चों को सिर्फ पाव खिला के सुला देते थे because there was no clients, no money. So that time we need a money. That time we need a support system from the government, not from other people. The people give ration, distribute. That is not sufficient.
Yeah.
The government, this is duty of Women and Child Department. I always say.
In fact, you have been working and you said this is what is the need of the hour. What are some specific policy and health interventions needed to address the threat among this community? Because Shreegauri ji, you have been working, you've been fighting, not only just working for the rights of the transgender community, not just for recognition and respect of their identity, but also for the right for adoption, livelihood. And now you're working with even the election commission, you're trying to tell them that, for the exercise voting rights. How tough has this journey been, and what role can legislation help the transgender persons?
No, I will say I'm very happy that I'm Election Today ambassador, and they have given me such a golden opportunity to prove myself and my community. So they have made some rules, if I don't have, see, you should have to understand from where I come. I leave my biological family. मुझे किसी हिजड़े ने पैदा नहीं किया. My mother and father were so-called heterosexual. So I leave my family. So I don't have my birth certificate, my other certificate. So now government of Maharashtra has, give us excuse. At least Guru can give the card. Other NGOs can give the card. So we are enrolling people. Now, last data, I will say 700 people in Maharashtra get registered for election duty, which is good number.
Yeah.
So at least we can prove ourselves. We can give voting and we can say that we are there. See, ek bhi banda hoga, his right. So this is going a good way. 2014, I'm just 7 years old.
Yes.
You are 79. Means, you should have to understand, But then also in my race, I say, if today is World AIDS Day, I don't want to celebrate this day every year. It should have to go. Yes, हम polio को बोलते थे, polio is gone. Still you do a vaccination. The vaccination should have to go. My sex worker kids, my sex worker women, sorry, I say sex worker kids. My sex worker women have to get a support system. Government have to look at them. Who is going to look at us? Only
so
dumping us condom.
Will play a huge role here.
Yes. The food, bank support system, the shelter. Transgender don't have the house because, you will see all transgenders, they live in slum. So we have the system. Now I'm on the board of Transgender Welfare Board of Maharashtra. So we are still fighting. At least I should have to get a shelter home where I can go and stay. A proper good house, proper sanitary things and all. Clean and neat toilets for my hygienic. If I will be healthy, I will keep society healthy. For this only, we have to understand. See, when we talk about sex worker, we are not only marginalized. It is like a gali to us. हम उस बारे में बात ही नहीं करना चाहते. Forget it. Let's come together. Talk open. We need a support system. Sex workers are not marginalized. Don't push them away from the society. We are the part of the society. My sex worker children, they are equal like your children. They should have to get school admission. They should have to get vaccination and everything.
Yeah, inclusion is of course key.
Yes, we use this word inclusion and diversity. Yes. What is the meaning of diversity and inclusion? हम सब एक है. We are Indian. Being a transgender, I got election duty ambassador. That means I have to prove myself कि मेरा एक वोट से भी बहुत सारा बदल होगा. Then
in fact, sorry for cutting in, but in fact, we were talking about inclusion, diversity, even another very strong core principle of the 17th Sustainable Development Goals and also of the AIDS response is that no one should be left behind. So obviously...
Yes. Zero. We say zero. Now it is zero. So 2020, this theme, every day theme. But I say कि HIV have to go now. How many years we are going to celebrate this? This is not my birthday. This is not my happy day. World AIDS Day, yes, I have to celebrate those, my friends, my supports, my sisters, which have died on AIDS.
Yes.
I miss them. And I have to look care of my young generation, young transgender. At least they have to save them life. STI, STI is curable, but HIV is still not curable. We don't have medicine, so we have to take care of our people.
Yeah. In fact, just a last question on this, going back to, like you said, a very important point. We don't need to celebrate it like a day. It's nothing. We obviously have to. It has
like Mother Day, Father Day.
Yeah. In fact, this is a day, like you said, it's an opportunity for each one of us worldwide, to unite in this fight against HIV. And obviously, the theme this year is very important. It's about ending inequalities, end AIDS, and end pandemics, because everything is somewhere kind of related. Yeah. So just a last question, I would like to ask you that do you feel, we've been talking about AIDS, we've spoken about your work. How big is the threat of HIV and AIDS among the transgender community? Of course, you've told us about, because of sex workers. So how big is the threat?
No, we don't see how I say first that we know that is a fact.
Okay.
We are in the sex work. We know that one day we will get infected. So we don't have threat. Now the question is, in this pandemic, how I will survive. HIV से मैं बाद में मरूंगी. अभी तो मैं भूखमरी से मरूंगी. Last night I was just looking the news. They say कि those who are HIV, they are in the high risk behavior. New third wave. I got if again pandemic will come, I won't die with AIDS. I will die on hunger. And that you have to take care of myself or my community people. See, Zindagi, it's very beautiful. We know.
Yes.
What work I do, might be you say ki sex work, everyone have their own opinion. But for my bread and butter, for my community, you have to give us another opportunities to prove ourselves. So many years, transgender are marginalized, they are pushed off the society. Only begging, only sex work, only bada is not. I don't have. That is my culture. How you could say it is my culture? Sex work is not my culture.
Yeah.
Bada is my tradition, my culture. But I was not having option. That's why I was pulled in sex work. Yeah. So we should have to think everything. Inclusion, when I say government, to whom I have to ask? Women and Child Department, the Transgender Welfare Board, they should have to make this such a good policies. They should have to ask community people.
I think those are some really important points which
you should have to ask community what are their need. You won't see, you call me at your place and you say, Gauri, I made a butter chicken. But I say I'm pure vegetarian. So what is the use?
I think that's really put. It's important to understand the need, especially this World AIDS Day, like you said, rather than celebrating it, we must understand that these global inequalities affect each one of us in some way or the other. And everybody is a part of the community. We need to make sure, understand the needs, like what you rightly said. And we need to, really start working towards it. Thank you so much, Shreegauri, for joining us today and speaking on this very, very critical issue.
Well, thanks a lot for giving me this opportunity. My daughter, she's just disturbing me. Thanks for giving me such a good opportunity, because see, transgenders need their voice to be vocal and they have to speak. I thanks to NDTV for giving such a good opportunity. It is not only for Gauri Sawant, it is for my community. At least people will listen and understand what are we facing. And not only just facing, I'm sure like as a nation, when we're talking about it, something needs to be done about it. Thank you so much. Thank you.